Is owning multiple properties only for the wealthy? What kind of property is in demand by district? Get these answers and more. Plus, stand to win $8,000 worth of cash prizes. Join us at our webinars this weekend on 29th and 30th May for essential property investment advice. What are you waiting for? Visit sps2021.99.co to register now. The Singapore Property Show 2021 is proudly organized by MediaCorp and our esteemed partners.
It's a human catastrophe of epic proportions. Thousands are dying every day in India as it battles the raging coronavirus crisis.
हमारे सामने उन्होंने दम तोड़ा, हम कुछ नहीं कर पाए.
मेरी वाइफ चली गई, मेरे दोनों ब्रदर इन लॉ गए और मदर इन लॉ एक्सपायर्ड हो गई.
Has India lost control of the pandemic?
If you step out right now, you step out to die.
India's COVID catastrophe. Insight, Thursday on CNA.
Updating tonight's top stories, Taiwan imposes its tightest virus restrictions. No dine-in allowed at restaurants, with weddings and funerals also suspended. Japan's government faces mounting pressure to cancel the Tokyo Olympics, but organizers are still going ahead with preparations. At least 3 people have died as Cyclone Yas batters India's east coast. Save the Children says the impact from the storm is complicating efforts to curb the COVID-19 outbreak in the country.
India is facing the second wave of the COVID crisis, and in the midst of that, while people are asked to be at home, there are lockdowns imposed, and in that situation, this cyclone where hundreds and thousands of people have to be evacuated, and they are not really able to maintain the social distancing and other COVID-related behavior that they are supposed to maintain, would really create a havoc. And at the same time, the floods, the high wind speed, and the tidal surges have already created havoc in terms of flooding the areas and also damaging the houses and property.
India has reported more than 208,000 new cases over the past 24 hours. That's a slight increase from yesterday, when infections fell below the 200,000 mark for the first time since early April. The country's daily death toll remains high, though, at more than 4,100 deaths. India has now more than 27 million COVID-19 infections and 311,000 deaths. It has taken the country less than a month to record its last 100,000 deaths. The World Health Organization says the variant that's first detected in India is now officially found in at least 53 territories.
Experts warn many people in India are dying before they can even access basic medical care. So amid shortages of beds, oxygen and medicine, citizens are helping each other bridge the gaps. Neha Punya reports from New Delhi.
These men and women should be in a hospital, not getting medical attention at this makeshift center. But as critical care beds continue to run short in Delhi and neighboring towns, they've been forced to turn to this Sikh temple.
ऑक्सीजन तो उस हॉस्पिटल में उनके पास अपनी है ही नहीं, वो तो साफ मने कर देते हैं कि है नहीं, आप एडमिट करना चाहते हैं तो कर लो, नहीं तो आप ले जाना चाहते हैं ले जाओ, ऑक्सीजन का इंतजाम आपको ही करना पड़ेगा।
Prem Singh lives in a small town more than 100 kilometers away from Delhi. He had been to 3 other towns in a desperate bid to source oxygen cylinders and essential drugs, but he finally had some luck here. For more than 20 days, thousands like Prem have turned to this Sikh temple when the government couldn't help them. At the peak of the capital's oxygen shortage crisis, volunteers helped those who couldn't get admission to hospitals and families that desperately needed medical oxygen, giving them a chance, however brief, to breathe easy. But even for the temple, finding oxygen supplies has been tough.
मैं आपको बताऊं कि 180 रुपए के सिलेंडर को हमने 5000 में भी खरीदा है, और जो इंक्लूड उसके ऑक्सीजन है वो हमने 25,000 से 30,000 में भी ऑक्सीजन लिया, जिसका हमारे पास खाली सिलेंडर भी हमारा हो जाएगा, तो वो हमने 500-500 किलोमीटर दूर से जाके परचेज किए हैं।
More than a month since the second wave started in India, it's still a scramble to access healthcare facilities in many parts of India. While more hospital beds are available in Delhi now, the epicenter of the outbreak last month, other cities and towns are struggling with similar shortages. In the absence of adequate government help, volunteer groups have stepped up. And people are turning to each other for help, especially on social media. Thousands of Indians have only been able to cope in the last 1 month because of the help of strangers who've amplified SOS calls and shared leads on where beds, medical oxygen and even essential drugs might be available. Countless such people have relied on Tehseen and Monica Poonawalla for help. Treating this like their full-time job, the couple has been calling in every favor, using every connection they have to help families get beds and medicines, arranging oxygen for hospitals on the brink of running out. They say they've lost track of how many people they've helped so far, but not a day goes by without an SOS message coming their way.
So sleep is about 2-3 hours a day, 4 hours at max. That's a luxury. We're always sort of trying to connect with people.
We've never really counted. We've stopped keeping account now because the phones ring almost non-stop even now, because it's now shifted out of the metropolitan cities into hard-to-reach areas and other states as well, and up in the hills. So it's all in blur, yeah.
But as the virus spreads to rural India, where 2/3 of the country's population lives and where digital literacy is low, people won't have the means to ask for help online. And that, along with the continuing paucity of critical supplies, has helped fuel the black market. Families have been forced to buy essential drugs and oxygen at exorbitant prices. And as black fungus cases surge, an antifungal drug needed for treatment is now running out at pharmacies but is available on the black market.
इसी तरह काला बाजारी पर लगाम हो, ऐसे लोगों पर सख्त कार्रवाई हो.
The police have been cracking down, arresting hundreds across the country in the last few weeks. The story of India's fight against the second wave has been one of acute shortages, even of vaccines. The world's largest vaccine manufacturer doesn't have enough shots to keep up with domestic demand, and experts warn if this shortage persists, vaccines could also end up on the black market. Plugging these gaps is crucial if India is to get its COVID-19 outbreak under control. Neha Punia, CNA, New Delhi.
Pakistan's government is also facing a mammoth task when it comes to COVID-19 vaccinations, as the country with the world's 5th largest population. To complicate matters, it also has to overcome a deep distrust of vaccines among the public. CNA's Maija Luto reports.
Dr. Sundas Durrani is receiving a dose of Sinopharm, one of 3 China-made vaccines available in Pakistan. Healthcare workers are the first here to be vaccinated against COVID-19, followed by the elderly. This is just her first dose, but Dr. Sundas says she is already very relieved.
मेरे भी बच्चे हैं, घर में बुजुर्ग हैं, तो कम से कम मुझे तो खतरा नहीं होना चाहिए किसी दूसरे के लिए.
Pakistan is trying to contain a third wave